is amazing. Morning guys, or should I say afternoon, because it is actually the afternoon. It's about 1 o'clock and it's Wednesday, so it's a work day for me, and I start early. I start about an hour earlier, so I get to finish an hour earlier today on Wednesday, just so I can do a bit of a handover with the full-time AO that's in the ward, and just we can just touch base and stuff. Otherwise we kind of miss each other with the shifts that we work when she finishes and I start. Yeah, so I am just chilling out now. I just got home. I haven't eaten anything apart from 15 minutes ago when I had muffins with avocado on it, and because I haven't eaten and I've been fasting every day so far for the last few days, not intentionally, but I just haven't been, if you see my last vlog, I just haven't been feeling the best, and also I just haven't been hungry, and I haven't really been thinking about food that much, which is great, fantastic. So yeah, so I've literally fasted today until 12:45 and I wasn't even hungry. I just thought, well, I need to eat something before I go to work because I might feel sick, and if I don't eat anything and I get to work, could come 5 o'clock and I'll be hungry, and especially when the dinner trolley goes around the ward and feeds all the patients and I'll just be like smelling all the food and be so hungry. So I didn't want to opt for something deep fried or, you know, something bad. So I thought, no, I'll just have avocado, even though I'm going to try not to eat avocado as much because I want to try and do a bit more of a low FODMAP foods, and avocados in that. It's just to help with IBS. So anyway, yeah, so I got my nails done. I just got like a matte, a purple color, and I just got it in the matte. So yeah, and I dyed my hair, got my nails done. It's amazing and I got some I got some concealer that I needed, and it was on special. I just get like the Maybelline Age Rewind one, and I've gotten that since like 2012. I've been getting it for the longest time because it said on it dark circles, so I'm like, I remember even telling my mum about it. Anyway, that's the one I use. It's pretty good, and it was on special. So, and that's my husband that just came home. But yeah, so I better eat this, and then I'm watching some Disney vlogs. I'm gonna eat this, finish watching my Disney World vlog, and then I've got to go get ready to go to work. So I'll catch you later. Bye. Hey guys, so I'm in the car and I'm ready for work. Yeah, so I'm feeling good today. Like I said, it's just those little things. When you dye your hair, you're able to get a little bit of makeup, even if it's just something you need. Like I said before, I needed the anyway, yeah, I needed makeup. I needed a couple of things, and I was able to get it today. But yeah, so, and you know, I've dyed my hair, I've got my nails done, so it's just little things that, with, you know, self-care, especially when you go to work, and you know, it helps you to feel a little bit better about yourself, especially if you're having a bit of a down, rough time at the moment. So yeah, so yeah, obviously I've got to go to work. I start soon, but hopefully I can get a car park in time, or get a car park easily, because that's the biggest issue, starting early, because the nurses do handover at 2:30, so obviously like they get to work the same time I do, and there's just no car parks usually that are available, so that's the issue. But anyway, so I thought when I finish work, I come home tonight after I put the kids to bed, I thought I would just maybe run through some tips or show you on how to get a job as an administration officer in a hospital, or as in for you know, in health, like a health administration officer, whether that's in hospital or the community or even a doctor's surgery. I've never personally worked there, but yeah, it's kind of the same thing. Programs might be a little bit different. In my opinion, if you go government, if you go private, like say for the Mater Hospital, they don't pay as much. If you go somewhere like health, somewhere like the government, which is Queensland Health, because I live in Queensland, so if it's, for example, Queensland Health, they pay really good. They pay a really good amount of money. So I just thought, so I've had heaps of people ask me, even my eyebrow lady asked me, she's asked me twice actually how to get into it. So yeah, so I thought I would, and I've had people over the years ask me about how they can get into it and how I've gotten into it. So I just thought I would show you and give you some tips if you're interested. So yeah, stick around to the remainder of the video. And I better put my camera down and drive my ass to work. Okay, bye. Hi guys! Welcome back to our YouTube channel. So today we're sitting in the mail room because we're not wanting to do any work. And I'm so sad that you're leaving me. Yes, I'm moving on with my life. Moving on from Kylie. She's done my head in for the past 4 months. No, just kidding. She's had enough. She's leaving me. This is what happens. They all leave me. Girl, bye. Yeah, I'll probably come back. So sad. Or it just sucks. You find a friend and then they leave you. I mean, I'm staying at the same hospital. Yeah, but still, you're not on the same shift as me. It's so sad. I know. I'm so sad. We only live around the corner. Who's gonna ring me when we start? And who's gonna like annoy me and I mean, like, I wouldn't say annoy, I mean entertain you. Yes. Yeah. Yes, you entertain me, you do. I don't know like what people would do without me. She's the hardest working person I know, and she entertains me, and doesn't matter what she's going through, she is awesome. Thank you, Kylie. I don't know what to say. And she thoroughly entertains me. I try. Every shift. I try to keep it light. I actually don't get depressed when I know I'm coming to work. I mean, she's there. Like, I get really depressed when you're not at work. I'm like, where the hell is she? Why are you? And then she brings me going, hey girl. And then one of the nurses pick up. I'm sorry, where's Kylie? Can you please put her up? Oh yeah, I'm gonna look for her. Like, someone holds for like 2 minutes. I'm like, oh my god, where is she? That was today. Yeah, I came back from the bathroom. I'll get off the toilet, I'm calling. And then the nurse says, oh, someone from Borat. Someone from like, down like Borat called. Wait. Yeah, it's Kira. Yeah. And then you're like, oh yeah, okay. And then I was like, trying to like, oh yeah, okay, I'll call you later. I'm just finishing this chart. And then, because I was the team leader, I was like, it's. How long have we gone for? We probably better get back and go do some work, hey? Yeah, because there's so much work to do. We're just flat out. We're really flat out today. Really flat out, like it gets really busy. We can't control our work. Yeah, we like to stay on top of things, get smash it all out, and today's just been one of those days where you can't keep on top of the work at all. Yeah, we haven't even taken a break. No, not at all. Not even to start this little channel. Bye. See ya.
I want to
it's a few days later, so I didn't get a chance to sit down and show you how I have gotten all my jobs in as a health administrator in Queensland Health, and that's obviously the state I live in. So yeah, I was just editing the vlog and I thought I would show you now. I'm sorry if you can hear background noise. It's late in the afternoon. Dogs outside are barking. My kids are inside doing their own thing, so apologies for that, but I'll just jump right into it. Okay, so what I did was I went into, most people know this if you live in Australia, or Queensland, should I say. So I just go into Smart Jobs, and that's the government website. Okay, so I just go into all, kind of broaden my search, and then I go down to admin. And if you want to be very direct, you can go into the department organisation and just click on health. Oh yeah, Queensland Health. Oh yep. So you just go search Queensland Health if you want to be very specific. Okay, and then just search. And then obviously gives you options. So AO3 is what you're looking for, because that's AO4 is a supervisor positions, AO5 is manager, and then it just increases, so on and so forth. Okay, so yeah, so first of all, you should be looking for AO3 positions because that's working with the public basically. Okay, so AO3 positions, and you should be looking for temporary or like contract sort of work. So I'll show you. So for example, so I wouldn't personally worry about applying for any permanent positions unless you're already employed into Queensland Health, for example. If you're already employed in Queensland Health, then apply for permanent positions if you're not already. But you need to just get into the door, and the best way to get into the door of Queensland Health is applying for positions like okay, so this is the positions that you should be applying for, is the Administration Officer Relief Pool. These positions are the best positions to get into, to just get yourself through the door, because that is what I personally have done. When I started back in 2013, it was a year after, it was my daughter was almost 1 year old. I didn't have a job, and this is the position I applied for when I got into the PA, which is Princess Alexandra Hospital, and I got in there as an outpatient department relief pool officer. So these are the positions you should be looking for first and foremost, and applying for as many as possible. You know, it can take some time. It took me about, I think, about 3 months or so to finally come across a job that I applied for that I actually got an interview for. So yeah, so don't be down the dumps if you haven't heard and it takes you 6+ months to even get an interview. Just keep applying and just work on your resume and just really make sure you put down, like, say for example you work in retail, or you work in, like I was saying, I was talking to my eyebrow lady and I was telling her, she was saying, you know, I was telling her that yes, she should include her job description, put down the description of what she does, but to really focus on
the keys that she does. Like she, works with people. She comes in contact with all different types of people, which is a big one. She is good at communicating. She, works on the front desk, so she does that general administration duties. Yeah, just things like that. Just really to focus on those specific things, surrounding the admin side of things, and then saying, yes, like, I do different things as well, but really in her description, but really focusing on those elements. So, your role and responsibility, this is kind of a really good indication of what they will be looking for and expecting. Greeting patients, providing a professional telephony service, providing directions and advice regarding locations and services and patients. So just being helpful and doing general administration duties and liaising with patients and staff members, and just whatever, like there's just really putting down there that you're, and things like something I put down on my resume, which is, or should I say my cover letter, something I really stated on my cover letter was how passionate I am to provide a level of customer service. And just remember that a hospital is still a business and the patients are still customers, so to speak. So you still got to treat that like that's a business, and be professional. And you know if you're passionate about providing a really good customer service, then that will work in your favor as well. So those are important attributes to, those are really important. But so, those are really important key points to focus on. It will show you things like, now AO2, you don't get paid as much because generally it's like, it's basically targeted. They basically describe it as if you're not working with patients. So you're more doing things like if you were doing data entry stuff, um, but you weren't actually, you were kind of behind the scenes of things, but you weren't, you had nothing to do with patients over the phone or face to face or anything like that. So the AO3 positions are the best. They pay. Now, see, if it says here part time, that can also mean contract too. So you can also get in on a contract and things like that. So on a contract, you will receive 32 to 35 plus dollars an hour. So AO3 position, it goes up, it increases, it goes in increments. So AO3 level 1 will be 32.19, and then every year it increases. If so, basically it's when you reach a certain amount of hours, it just automatically increases. You don't need to do anything, it just increases. And the most amount that you will receive in that level 4 is $35.98, and that's what I'm on. I'm permanent, but permanent and contract, obviously it's the same amount of money. And that's said again for casual. So if you're casual and you're not on contract, you're not permanent, you'll be paid $39.59 to start off with, and then as you progress in your hours, every year you will go up to the top level, which is $44.25. So yeah, it's important for you to make sure that you really look at your roles and responsibilities and just go through what they kind of are looking. It helps give you a good indication of what they're looking for and what you need to really put on your resume. Make sure that you have. And yeah, just so again, this is another position that's perfect. It is AO3, it's in Brisbane North. it's casual flexible. So that would be another relief pool position, I think. So yeah, so just look out for those positions and just apply for as many as possible. And if you apply for positions, you just have to sign up to, you just sign up and you just register. And then once you've registered, so it'll give you a list of every position that you've applied for, and you can just keep track of them all and see how they're progressing. Some of them don't bother putting like the status, updating the status, whether it's in progress or if it's finished or ended, or some of them will still say submitted and then not even, it's just, they don't even bother updating it. So I have applied for a lot of positions, and the first one I applied for was 2014 when it was in Smart Jobs. When I applied back in 2013, that was before it was in Smart Jobs, and it was just in another thing. I can't even remember what it was called, but anyway, Smart Jobs is where you need to go if you live in Queensland. And if you don't live in Queensland but you live in Australia, just Google, because that's what I did. That's how I did it. I just Googled, say for example, you live in Victoria, so just go Vic Health admin jobs. And they might have their own government website. So that might be their job site there. So just type in, just make sure you type in, whatever state and then health admin jobs, because that will really help narrow it down a bit more. But so there should be, admin, clerical, I don't know if this is actually, I think this is a state one, but it's not as good as the Queensland website. It's so much easier on Smart Jobs. But so that's the end. I really hope you liked my work vlog, and I hope you got something out of the tips that I just gave you. If you want any more information, I'm happy to go into a little bit more detail in another vlog or another video. Just let me know down in the comments if you have any questions. I'm more than happy to answer them for you. So that's it for me today, and so thanks for watching. If you haven't subscribed, I'd love you to subscribe, and if you want to hit the notification bell, and it lets you know when I've posted. But until next time guys, I'll see you in another vlog. Thanks for watching. Bye!